80% of the immune system is in the gut. So if your gut's messed up, are you going to be able to resist something like COVID? If most of the serotonin in your body is produced in the gut, there's more in the gut than there is serotonin and dopamine than there is in the brain. So is your depression a Prozac deficiency, or is it an imbalance in the healthy, good bacteria, bad bacteria in the gut? Gut infections are extraordinarily common. It's not given a lot of credence in Western medicine. There's a couple of good tests. The one that I do in particular is the GI map, because it uses a PCR test to determine what kind of gut biome, what kind of bacteria and critters we have in the gut. With antibody testing, if your vitamin D is low, like most people north of the Mason-Dixon line will have low vitamin D, that impairs the ability of the body to make antibodies. If your white blood count is low, you may not get an antibody response. If lymphocytes are elevated, you may not get an appropriate antibody response. So it depends on how your immune system is working as whether or not you'll get an antibody response. And the GI map is a PCR test, so it's not dependent on whether or not your body is making antibodies to perceived threat inside the gut. If they're inside the gut, that's fine. But once they get outside of the gut into the bloodstream is when it triggers a massive immune cascade and sets off. And the genesis of food allergies are partially digested food proteins getting through the porous border, and things that cause porous border cause lesions in the gut because it's only one cell thick. The chemicals in the foods, inflammatory foods, the standard American diet. I don't know about you Canadians, but the standard American diet here is full of inflammatory foods. Yeast infections in the mycelial form can cause perforations in the gut. And then cortisol is an underlooked aspect of lack of gut integrity. So these are border systems. You have the gut border, you have the bronchial border, and you have the blood-brain border. That's to protect us from things outside the body. And like the skin is the outer covering, that protects us from things in the environment. But the gut is a whole different environment inside the body, and we have to be protected from those. The last thing you would want is to have a perforated bowel and it emptying the contents of the abdominal cavity. You're not going to survive that without major surgery and antibiotics. So the integrity of the gut is really important if you want to age well and function as we get older.
Mm-hmm. Absolutely. And I see this on a regular basis, actually. So it's actually surprising what percentage of people are actually having symptoms like this and not really understanding what is contributing towards it.
Well, if there weren't a boatload of gut symptoms, you wouldn't have Prilosec, Prevacid, Omeprazole. The little purple pill from Dr. Larry the Cable Guy is over-the-counter medications. Mm-hmm. But those drugs were designed for an 8 to 12-week course of care. And you routinely run into patients that have been taking omeprazole for 20 plus years. So they've totally altered the ecology and suppressed the hydrochloric acid in the stomach, which is what triggers the pancreatic enzymes to be released in the small intestine. So it totally alters the ecology and the pH of the gut. And it's going to alter your absorption, your amino acids, the production of serotonin and dopamine, and it's going to alter your immune function eventually. Mm-hmm. So it's just, there's a lot of things, a lot of medications, non-steroidal anti-inflammatories and aspirin and things. People eat those like chiclets or because they're over the counter and they think that they're perfectly safe, and they're not.
Mm-hmm. Absolutely. So we've mentioned that foods definitely contribute to, breakdown of the lining. Do you have sort of a diet that you recommend? I don't like using the word diet, but nutritional counseling as to what you recommend.
I don't use diet because diets, mm-hmm. people automatically go to deprivation consciousness. Absolutely. Oh, I can't have blah, blah, blah. I frame it in terms of let's make the wiser choice. if you look at what's available to you and you make the wisest choice, there's no negatives, there's no limitations associated with that. I'm always going to make the wisest choice, as I'm planning to be around for a while. The greatest things I will see or do in the course of my life quite probably are still ahead of me. The greatest books I'll write are still ahead of me. The greatest impact I'll have on a patient's life is still ahead of me. So it's like, yes, I'm going to make the wisest choice. I refuse to be a third generation diabetic. So I do better myself with a proteins, veggies kind of diet. I use my slow cooker and convection oven quite a bit. I can throw something in the slow cooker, walk out in the morning, come home in the evenings, steam some vegetables, call it dinner. Easy peasy, simple. I don't eat fast foods. When I do eat out, I eat very simply, because I've been gluten free for about 8 years based on testing, no symptoms. But I mean, the information about the inflammatory aspect of gluten has been just so overwhelming that I had to spend the money to do the definitive test. And sure enough, it came back, I have an immune response to gluten. So no symptoms associated. I assumed if I had a gluten exposure, I would have gut inflammation, but I didn't. I had neuroinflammation. I had vertigo the next morning. My friend that had lunch with me had a migraine headache before she got home. I was down for 40 hours with vertigo. She was down for 5 days with a migraine. So we're both maniacally gluten-free, because I don't like, can't is not part of my vocabulary. It's just, I'm a willful child, have been for nearly 70 years, and I don't intend to change that. I don't accept limitations well. So it's gluten-free out of necessity, because I don't want to experience another 40-hour episode of vertigo. And the biggest part of the gluten response is neuroinflammatory. So in my world, gluten is pretty much a song and dance number with the devil. 50% of the American population is genetically intolerant to gluten as it exists today, according to some studies. So it's just, I'm not willing, I have control issues. I'm not willing to eat foods that I know have a potential of driving neuroinflammation. So gluten and dairy and the boatload of sugar that people are eating is just, for 30 years, I've told patients, go to the market, find the biggest person or the least healthiest person in the market, look at what's in the basket and don't eat any of it. Then find the healthiest person in the basket, and it's going to be a different basket of food, I promise you.
Absolutely.
So, I mean, it goes back to the diet.
Yes. And, it's tough to stay on track all the time, right? I know when I was chronically ill years ago, I think it was 7 years I went without putting anything white into my body, ever. But I look at to me, it bought me my life. I could have chosen the medication route, and it's not easy. Like, it really isn't easy to change a lifestyle, but it does become habit forming. So it can, you will find the longer that you do it, the easier it gets, and the more substitutes you find that are satisfying.
Nothing worth doing is really easy. And it's just, getting older isn't easy, but we're all going to do it. And at this moment, the fastest growing portion of our population demographically is the old, the 85 to 90-year-olds, followed by centenarians. In all honesty, all of us over 50, the greatest things we may see or do in the course of our life may still be ahead of us. But we want to be as well as possible, as long as possible, and God willing, have a quick exit and wake up dead some morning a long time from now. And I'm going to do everything that I can to facilitate that. I'm going to be a good boy most of the time. As you see a boy over 50 doing stupid stuff, it's like, come on, dude, grow up.
Yeah, it's true. Every time, it's funny, a friend of mine once said that exact line to me when I was putting a half a teaspoon of sugar into my tea. And he said, why are you doing that? And I said, I don't know, I can't, it's so bitter to me without it. He said, but it's time to grow up. And it's funny, every time I think about doing something like that, I remember that one line he said to me. So, but I mean, I don't want to condemn anybody that does it, because
No. Well, it's not about limitations, but it's about making wise choice. And
absolutely.
If people are good 80, 85, 90% of the time, and you want that scoop of ice cream, go for it. Once you get your health back, we should have enough fluidity that we can have a scoop of ice cream. I'm a Southern boy, so I'm going to have a piece of pecan pie, but it's one I bake that's got a gluten-free crust or no crust at all. So you can make wiser choices. Is a piece of pecan pie a good choice? Maybe not, but I've had a protein-based meal to help accommodate the glycemic rise. And it's not something I do all the time. It's something I do maybe once or twice a year.
Exactly. It's the amount, it's quantitative. I think we
Yeah.
really need to, take a look at that. So I guess the next thing is, you talked about how that food affected you neurologically. And we mentioned the word neurotransmitters. So I was wondering if you could just explain to our viewers what a neurotransmitter is.
Neurotransmitter is a chemical that has an impact on the neurons. Learning and processing information is acetylcholine based. Happy hormones are dopamine based. Anxiety is a GABA base. Serotonin can affect depression and sense of self. And most of the neurotransmitters are produced in the gut. So a healthy gut is really important for you to have a healthy and happy life. Taking Prozac or Zoloft or something for a short period of time is not inappropriate. I don't throw the baby out with the bathwater, but my $64,000 question is, okay, why do you have heartburn? Okay, why are you depressed? It's situational. Your mom just died. You're getting a divorce. I understand that. Medications short term until we get over life's rough spots. But I think we're far, far too reliant on medications to fix all of our issues, which keeps people from assuming responsibility. It's my responsibility for making choices that minimize my risk for developing diabetes as I get older. It's my choice to eat the foods that serve me and stabilize my blood sugar. It's my choice not to eat the garbage processed foods. And it's a matter of choice on a day-to-day basis. If you want function, I want function. My mom will be 96 in August and is functional. So if she's functioning at 96, I'm probably going to be an old codger. And if I'm going to be an old codger, I want to be a functional old codger.
That's really important. It's important that we let people know that, if you are presently on this type of medication, you've been on it for a long time, you definitely don't want to come off it cold turkey. You definitely should be under the supervision of a professional. So
Absolutely.
I want to make sure that we reiterate that, but we also want you to realize that some of the time, not all of the time, a lot of these conditions come from, gut issues, right? If we get to the root cause of these issues, things can improve. And that's where we're trying to get you to today, to know that it's up to you.
Diet and lifestyle, it's your choice. And I want to be functional as I get older. And I think everybody does. Over the years, I've had patients and they were, well, if I'd known I was going to be this old, I would have taken better care of myself, and I want to thump them because nobody's guaranteed tomorrow. But statistically, chances are most of us will see tomorrow. And it has nothing to do with deprivation. It has everything to do with reinforcing and supporting the quality of your life so that you can live life actively and fully and engaged. And life is supposed to be a joyous prospect. We have bumps in the road, but we're supposed to be able to resist something like COVID. And that 500,000 plus people died of a variation of a cold virus. When CDC says only 6% died of COVID, the other 94% died of comorbidities. In a day and age when we can do hip replacement and knee replacement, heart transplants and kidney transplants, we can do medical miracles. But that tells me that our base patient population is massively unhealthy. And it goes back to diet and lifestyle.
Absolutely. Yeah. And that's our role here. Our role is to sort of, get people to a point where they know that they need to work on building their health, building their immune system, and going back to the basics so that, when they do get confronted with these things, they have a better chance of surviving it. Right.
Well, It's education. That's what we do the most
Mhm.
of, is we educate, we empower people. Knowledge is power. If you know there's something going on with your blood sugar, then you can do something proactive instead of waiting until you're diagnosed diabetic.
Right, exactly. So you mentioned too that we were going to talk about stress and cortisol. So I'm going to lead you in that direction.
Okay. Uh, People don't give the credence to cortisol that it really deserves. That's the fight or flight. That's what allowed us to run from saber-toothed tigers a million years ago, so that we survived. It's an instantaneous autopilot response. But one of the things that cortisol does is it pulls glycogen stores out of the liver and the muscles so that we have fuel for fight or flight. It also inhibits blood flow to the gastrointestinal tract and will rip apart. There's two proteins, there's occludin and zonulin, that kind of knit together that fine string of cells lining the gastrointestinal tract. And cortisol will rip those apart. And sometimes, if there's enough of that damage that's done, you can get antibodies to occludin and zonulin, because those are proteins that's supposed to be inside the gastrointestinal tract, holding those cells together. They're not supposed to be in the bloodstream. So cortisol will pull those cells apart. And that's really the genesis of food allergies. It alters gut function substantially because of inhibition of blood flow to the gastrointestinal tract. You can have an incredible, pristine, perfect, organic paleo meal, but if you don't digest it because of how you deal with stress, or you're taking an over-the-counter proton pump inhibitor that's interfering with hydrochloric acid production, you might as well go to McDonald's and have a Happy Meal, because you're not going to get the benefit of having a really good, clean meal. We can always make wiser choices, and staying on top of blood sugar regulation is huge. Research in the last couple of years are calling Alzheimer's and dementia type 3 diabetes, or brain diabetes. So your ability to function cognitively as we get older is very much related to how well we manage our blood sugar now. And if we keep our blood sugar stable, because that blood sugar roller coaster also has a big impact on serotonin production.
Mhm.
So stabilizing blood sugar sets the stage for you functioning well enough where you might be able to have a conversation with your doctor about getting off your Prozac or your Zoloft, because we don't have Prozac deficiencies or Zoloft deficiencies at the root of any health problem. And Western medicine, in their 30 seconds that they give us, never ask the why. And the why is the most important question. Why? Why do you have depression? Why is your blood sugar? Why? That's the most important question, is why. Because these things don't happen in a vacuum.
Mhm. Absolutely. Wow. So we've covered a lot of things today. So, what's your recommendation if you were somebody, if you were um, a human being out there that's struggling, they're doing everything the doctor says, right? But they're just not winning. Where would you go? What would you do next?
First thing I would do, well, one of the things that I'm a really big proponent of is stabilizing blood sugars, eating regularly, eating enough protein to keep your blood sugar consistent. You should be able to do 25, 30 grams of protein and be a rock star for the next 4 hours. Because if we want to think mechanically, we're fueling the Ferrari. So if you have a Ferrari sitting in the driveway and there's no gas in the tank, you're not going anywhere. So if you put gas in a tank, you should be able to hit that racetrack for the next 4 hours. Do another fueling, hit the racetrack for the next 4 hours.
Mhm.
There are supplements that help in healing the lining of the gastrointestinal tract and help healing on a systemic level. That may be a conversation for another basis or another day, or if you want to get into that now, we certainly can.
Mhm. Well, and I think we can definitely leave that where people can contact you directly. We'll make sure that we post your email address for them. It's actually drdavidinc@gmail.com, but I'll make sure I put it in the comments as soon as this talk is finished. So you'll be able to reach out to him. If you're in the Canada area, you can definitely reach out to me at a different kind of better clinic, or a different kind of better calm, and just message me. Any questions that you have with regards to what Dr. David has been talking about today, which has been amazing. Thank you. definitely post them in the comments below. I will make sure that he gets them, or you can email him direct. I'm sure one of us will get you the answers that you need. We're not going to leave you out in left field with a talk and then nowhere to go afterwards. But know that there is help out there. That's the whole point of this. And I think, without saying the name of the particular product, I think it's probably a good idea maybe to just let them know that there is a product that's available, how it basically works, and roughly how long it takes to restore the health of that gut lining. That would be awesome if you have time to do it today.
Sure. I always suggest that people anticipate some time. I'm 60 plus. This not an accident how I got here. And I'm the end result of every choice I've made, good, bad, and otherwise, over the last 60 years. Butyric acid formulas have been around for a number of years, going back as long as a quarter of a century, to provide the gastric mucosa with an energy substrate that allows it to heal. So that's the first thing that I would start with. If there's infection, the infection has to be addressed. I use botanicals for bacterial infections and botanical combinations for fungal infections. There aren't too many gut viruses, thankfully, but there's a lot of bacteria, fungal, and a lot of other critters and parasites and things. But the butyric acid is one thing to help heal the lining of the gastrointestinal tract. And the nucleotides product is also good for healing. They're little chunks of amino acid sequencing that the RNA uses to make the next generation of DNA. So nucleotides are a powerful tool for healing down at the very base core level. And how much do I take? How long do I need? It varies from person to person. And we have to anticipate investing some time. I usually suggest that people anticipate a month for every year that they've been sick. So if you've been sick for 10 years, 10 months is a reasonable investment of time. And you're not going to do it with the standard American diet. You're going to have to make some dietary changes. The things that people have, I've been in Southern California for 40 years. I go home and I see the things that friends and relatives are eating, and I'm appalled. With a diabetic family history, it's family, so I keep my mouth shut because nobody's a legend in their own family. But it's that, and that's why I talk in terms of choice. Let's make a wiser choice. The standard, if what you're doing isn't working for you, please make a different choice. Look in a different direction. As I think that everything that anybody is dealing with in terms of health can be improved to an extent, if not moderated completely, with proper diet and nutrition. That's the one area that Western medicine absolutely completely fails. I love the name of your clinic, A Different Kind of Better. Amen. That's what we're shooting for, a different kind of better.
Yeah. And, I always call that divine intervention because that just popped into my head. And I was really grateful that it did, because I think it, speaks volumes about what our vision is and what it is that we want to do. And, most of us, I don't know whether it's the same with you, but most of us practitioners, I started in Western medicine. That was my background. And I did that for years in many different capacities. But it wasn't until I became chronically ill and sat on the other side of the table and fought that Western medicine journey for 2 years before I realized that it wasn't, I was on a downhill slide. I was not winning. And that's where we learn that we usually end up in this field because we are living proof that we've come from what I call the deep, dark pit of being close to not surviving. And then come out the other side and go, oh no, there is another way. And I want to help people with that way. Because
Absolutely.
to be honest, that journey, the 2-year journey that I had doing that, and it's not the same for everybody. I'm not saying this is for everybody, but I'm just saying that 2-year journey that I had with chronic illness, the side effects from the treatments sometimes I think were worse than the illness itself. What I
Yeah, but those are
found,
lessons you'll never forget.
yeah, and what I found with the natural side of things, I didn't have the same side effects. I didn't recover fast. However, I recovered.
Yeah.
And, and that was, my son is now 25. I got critically ill when he was about 5 months old. And so you look at that and you go, look what could have happened and look what has happened. And there are tons of people like me around. And I just feel that we need to do more of this. People like yourself, and this is what we need to do. We need to educate people and let them know that there's a different way.
And always count your blessings. Be grateful.
Mm-hmm.
That's one of the things that a lot of people have lost track of is gratitude.
Yes.
Could always be worse. Has been worse. We're expecting better. Because I choose to see that glass is half full. It's a choice on a day-to-day basis. And it's just, I choose to eat well because it makes a difference in how I feel and how I function. So it's just, it's the only time it's really too late is when they're lowering the box in the grave. We can't do anything beyond that, but anywhere between here and there, we can make some improvement.
Yes. Yeah. I think being grateful, being humble is really important, because I think mindset is important in your journey as well. Right.
Absolutely.
And so is there anything else that you'd like to sort of impart on our viewers that you think may help them before we?
It's your health. It's your health. You're really the one that's responsible. And if you take nothing else away, it's just learn to make better choices. If something has a longer shelf life on it than the one that's tattooed on the left cheek of your butt, put it back on the shelf and don't eat it. Everything has an expiration date on it, and we want to stretch ours out as long as possible.
That's really great advice. So, at this point, I just want to say thank you on behalf of everybody that's going to tune in and watch this talk over the next week, months, years. We appreciate everything that you do, and we hope to have you back sometime for another topic. Maybe talk about that book that you're going to be writing in the future. I'm looking forward to that. I'll be one of your first people that jump on and read it.
Oh, cool. Thank you.
So take care, everybody.
Happy to be here. Take care, everyone. Be well.
Yes, definitely be well. And we'll be different kind of better. We'll come to you again soon with another speaker and a different topic. Please watch out for our live notifications. Take care and have a blessed week, everybody. Thank you for joining us. Goodbye.
Take care.